When you hear the word crisis or public health emergency, what is the first thing that comes to mind? Maybe the Flint water crisis or the H1N1 influenza pandemic? What about pain or pain control? Probably not as much of a crisis unless you are the one in pain. However, in 2017, the Department of Health and Human Services declared the opioid epidemic a public health emergency and started creating a plan on how to combat the crisis. With people dying every day because of opioid overdose, it is important not only for medical personnel, but also society to change what we are doing to prevent unnecessary deaths from occurring. In 2017 alone, there were over 70,000 deaths related to drug overdose. According to the National Institute on Drug Abuse, it is estimated that over 130 people die every day in opioid-related overdoses. This means every 10 minutes, a person dies unnecessarily. So how do we fix it? First, we prevent it. Then we hold people accountable. Finally, we treat it. Each state currently has its own prescription drug monitoring program. These programs allow doctors to check what prescriptions are being written for controlled substances and for the individuals that they are seeing. This allows them to have the knowledge of what drugs are being previously prescribed, what strength, how often, and how many. This helps limit overriding of prescriptions of controlled substances. It prevents people from going to different doctors or doctor shopping to get the same prescription. This is a great idea in theory, but the accessibility and ease of traveling from state to state, this is not enough. According to the National Association of Boards of Pharmacy, only 45 states have joined the National Prescription Drug Monitoring Program. With increase of monitoring prescriptions, this should in turn cut down on the number of opioids that are dispensed. The fewer pills that are dispensed to the public, the fewer chances of individuals becoming dependent or addicted, and the fewer chances of them being sold to other individuals. There are few cases, for example, of individuals with cancer or those in hospice where it is necessary to control their pain, and a controlled substance may be used but not need to be questioned as rigorously. However, for those receiving opioids for pain management on a regular basis, there needs to be some kind of follow-through. For those using their medication correctly as prescribed, you should be able to tell by completing a non-invasive urine test. If the drug that was prescribed matched the therapeutic level for the drug in the individual's system, they will be cleared to receive their next dose. This will help to decrease the amount of opioid medication that is available to sell on the streets. Naloxone, more commonly known as Narcan, is an opioid antagonist. It reverses the effects of opioids temporarily. It comes in a nasal spray or an auto-injector. They also have trainers to walk you through step-by-step on how to do it.
This trainer contains no needle or drug and is for training purposes only. Do not use this trainer during an allergic emergency. If you are ready to use, pull red safety guard down and off of this trainer. Place black end against outer thigh, then push firmly until you hear a click and hiss sound. And 2, 1. Training complete. This trainer may be.
This is something that you can get in 48 states at CVS or Walgreens without a prescription. However, this is not something that is well known. There needs to be more information made available to the public. Along with that, there needs to be training classes made available for individuals on how to use it and when to use it properly. They need to know the side effects, what it does, and how it's only temporary. It can and it will wear off over time, and the individual that was using drugs will go back into overdose. Holding individuals accountable, both doctors writing the prescriptions and those receiving the prescriptions, is vital in dealing with the opioid crisis. Allowing those in need of adequate narcotic pain medicine to continue receiving their medication under strict guidelines will help the addiction levels to minimum and will keep opioids off the streets. Also, we as a society need to become aware of this, that it is a major problem, but still a fixable one. We can help by educating ourselves with signs and symptoms of opioid overdose, how to properly administer Narcan to save individuals' lives. The crisis is one that can be stopped, hopefully before it takes another life.